Well, I think that people always thought it was for old people, because originally when it came out, it was mostly just about nursing home. It was about nursing home coverage. We often call it nursing home avoidance coverage, because the reason we have this is we want to avoid the nursing home. But as more and more home care options become available, it just became much more mainstream. But there are many things that require long-term care. Some of it isn't even, it's not just end of life. For example, I had a 55-year-old woman who had bought long-term care when she was 52 or 53, but then she fell and she broke her wrist and her pelvis and had some real bad complications with bone infection and all of that. So she was able to kick in and use her long-term care insurance during her rehabilitation, which was about 8 months. So she used her long-term care insurance, 8 months goes by, she's rehabbed, she no longer requires assistance with her long-term care needs, so fine, she stops drawing off the policy, and then down the road it's there to pick up. The other reason that I feel very strongly that people look into this earlier rather than later is that you just never know what's going to happen. I had worked with a mother and father years ago, and we talked about long-term care insurance. They owned a very successful car dealership in our area. And the daughter was 48 and she was going to be taking it over as they retired. And I had suggested to them that they might want to consider buying the long-term care insurance for the daughter and son-in-law also, because the business could pay for it, there could be tax advantages, etc. But then one of their advisors had said, well, they might be a little young for that, so why don't we wait, it's a good idea, but let's wait until they're 55 or so, and then we'll look into the long-term care. Well, again, he was 48 at the time, and by the time he was 55, he had stage 4 pancreatic cancer. And the care that had gone into him, just a few years during that illness was really difficult, and they went through a tremendous amount of money. Had they bought that protection, again, they would have had that buffer. They'd have been able to stop that bleed, and it would have caused a difficult situation to be a little less stressful.